Malawi has delayed the opening of public schools in the country's two major cities of Blantyre and Lilongwe. The Health Ministry says that the aim of the delay is to slow down a surge in cholera deaths. It says that the total number of cases and deaths have accelerated to 17,824 and 595 respectively, and that's since cases were first reported in March. Meanwhile, 25 people have died of cholera within the last 24 hours on Monday, pushing the number of total deaths now to 620. According to the Ministry of Health, 409 new cholera cases have been recorded, with 822 patients currently in treatment units across the country.
Malawi's health minister says primary and secondary schools in Blantyre and Lilongwe will no longer commence classes on the 3rd of January as earlier advised. She said a new reopening date will be announced later. Malawi's health ministry says the mortality rate has increased to 3.34%. The yearly rainy season in Malawi from November to March brings with it recurring challenges of cholera outbreaks, resulting in about 100 deaths a year. The current outbreak is projected to be the worst yet, with victims including health professionals at public facilities. Malawi's health ministry has called on authorities to tighten control measures, including intensifying mitigation measures such as spraying of chlorine to disinfect congested places such as markets and schools, as well as increasing the rate of inoculation.
Well, for an update on the situation, we're now joined by Rebecca Chimjeka, who's an investigative journalist with the Times Group in Malawi. Rebecca, thanks very much indeed for joining us. Welcome to the program.
Thank you so much.
All right, Rebecca, perhaps you can give us an indication of what might be the impact of this delay in opening schools in Blantyre and Lilongwe.
You know, as usual, this would affect the students in catching up on subjects, as students in other districts would be in class. You know, Minister of Health says the decision is one way to prevent the cholera deaths.
Do we know how long this delay will be for? Has the ministry, the government said at all?
According to the authorities, they say as long as perhaps the disease has minimized, is going to minimize, then perhaps they will open the schools.
Who is most affected? We see that Blantyre and Lilongwe has been targeted. Is cholera not across the country?
No, every gender, I would say every gender has been affected. But according to the data from the Ministry of Health, more males have succumbed to the disease than females. And the reason being, a lot of men are always lazy to go to the hospital and when they are sick. And perhaps because of shame.
It seems as if this is something that happens every year. What's the government been doing to try and mitigate and stop this?
Government is attributing this to cyclones. You know, we have been Malawi has been hit by cyclones for, I think, for the past 2 years. So, you know, there's always a thin line between water and cholera outbreak. So perhaps this is why the disease is now spreading like fire.
Is there any reason why it seems to be worse this year than times seen in recent years?
Yes, it's worse this year because, you know, the deaths of people that have died, it's alarming. So I think it's the worst cholera outbreak in Malawi, and especially in the cities of Blantyre and Lilongwe, you know, the main cities. You know, Blantyre is the business city of Malawi, while Lilongwe is the capital city of Malawi. So for the cities to have the burden of the disease, I think this should be the worst cholera outbreak.
What help is the government able to assist with? Yes, we know that some people are getting treatment. There's this delay in opening the schools, which is an intervention. What else have they been able to do to try and assist people and to contain the disease?
Yesterday, I had an interview with the Minister of Health, where she confirmed about the recruitment of 128 health workers to help in the district that have been affected with the disease, because hospitals have been overwhelmed with the cholera patients, and Malawi has other diseases that need attention, and there is a call from a nurses organization that this is an opportunity for government to absorb hundreds of nurses that have been remained unemployed for years, so that perhaps they could help in the hospitals in the country.
What is President Chakwera saying? Carry on.
However, government is encouraging people to get cholera vaccine, and people are going to get now. A lot of people are going to get the vaccine.
Why weren't they getting the vaccine? They've seen people dying each year. Why the hesitancy?
Yeah, even during COVID time, when the government was telling people to go for vaccine, most of the times people are reluctant. There are also beliefs. Some religious leaders would prevent their followers to go and get the vaccine.
All right. So what can be done in the meantime? You delay the schools. You try and get people vaccinated. What else are people being encouraged to do? Stay at home or what?
No, for me, I think this is the time. It's for every Malawian to be responsible, because everybody owns her health, his health, and it's just a matter of people being responsible, cleaning their environment, and as well as eat hot food, or they should stop buying food in the streets. The city council 3 weeks ago said they had put some bylaws for people to follow, but as of yesterday, as of this week, I've never seen people stopping that, because they are still buying cooked food in the market, on the open market, and it's where this disease is. So I think it's everyone's responsibility to take care of his health or her health.
Are people aware of how the cholera spreads? Are there education programs, and are they being heeded? Obviously not being heeded, but are there programs there?
Government has tried its, the disease started in March. Government has been telling people through radio stations, TV stations, through newspapers, please, people, let's prevent this disease. Because when it comes to rainy season, it's going to, we cannot manage this disease. But I think all we need is mindset change. I think there's need for mindset change. And if the government is telling us, authorities are telling us, the disease the outbreak is here. I think it's everybody's responsibility to do that, to prevent the outbreak.
So the rate of infection, has it reached its peak yet, or are there more numbers and the numbers are rising each day?
Unfortunately, numbers are rising each and every day. And when you go to hospitals, health centers, you will find cholera patients. And even private hospitals, people are going to private hospitals not knowing it's cholera. So, and the private hospitals are now even treating people with people those that are sick.
Are people frightened, Rebecca?
Yes, they are. They are. No wonder everybody is going to get to get a vaccine, because I've seen a lot of people queuing for vaccine. Even me, I went for the vaccine like last week.
Yeah.
Because it's, you never know who has cholera now.
And this vaccine, what do they say? How long does it take to be effective? Is it immediate cover? What are they saying?
I think it's an immediate cover. It's with immediate effect. So it perhaps if you get the vaccine, then you are assured of being you are assured of being perhaps assured of, or not to catch the disease. Okay, you can catch the disease, but perhaps you can't get sick as the way cholera is. When somebody is sick, it's terrible. It's terrible.
All right, Rebecca, we're going to have to leave it there. Thank you very, very much indeed for joining us. Zikomo Kwambiri.
Zikomo.
All right, thank you. All right, that's investigative journalist Rebecca Chimjeka, who's telling us about this cholera outbreak. It's been in the country since March, and there was a fear that if they weren't able to contain it by the rainy season, which is upon them now, that these numbers would surge. And this is exactly what we're seeing. Hundreds of people dead and thousands more infected.